And I know you're like, well, crap, that don't tell me nothing. But from my perspective, I'm like, well, I don't know what you're eating all day. Because, like, if you're doing intermittent fasting and you're not eating all day, no, I don't think so. It'd be really hard to eat one meal and gain that many calories. Also, it's the type of food you eat. If you're on, let's say, keto and you're eating proteins and fats, and not with some of the ratios that's out there that's like 50-50 or more fats than protein or whatever that crazy stuff is. Now, if you're like anorexic or something, I don't care. I mean, you just need to eat. But as far as that prescription with fat and protein ratio goes, if you're eating enough protein, then I don't think you're going to have a problem. But if you're eating your meal, and it's like he was talking about sandwich meats or snack meats. So let's say he had 3 pieces of meat, sandwich meat, but 9 pieces of bread. I really have a feeling that some of that might store as fat. But what if you ate 20 pieces of meat and 1 piece of bread? Which I don't ever recommend bread, but I'm just giving you an example. Or a cracker, 1 saltine cracker, or whole wheat cracker, rice cake, 1.
So why don't we just leave out the carbs? Yeah, just if you want to fucking snack at night, eat meat.
I don't know what he likes to eat. You know, it's hard sometimes to force somebody to eat foods they don't like, and it's really hard to get used to taking away foods you like. With especially he referred to keto, so I say that there.
Well, I like ice cream. Like, I get home at night and I want to eat half a fucking pint of ice cream, and that's what's going to happen is I'm going to be fat. So if I eat, would it be safe to say I could eat all the fucking meat I want before I go to bed if I don't eat carbs with it?
I mean, yes and no, because it's really hard to eat enough meat to gain fat. Because I know your appetite, I know my appetite, because I've known you a long time. But some people I know, I mean, they can eat. I mean, I've seen people eat 10 pounds of meat in these hot dog eating contests. Well, they can probably gain fat. But if you're eating a reasonable portion and you're not eating more than 2 chicken breasts or 3 chicken breasts maybe, or somewhere around there, that's a lot of food. Or if you're eating egg whites. I mean, for a long time, I ate 20 egg whites every night as my last meal. 20. That's a lot of food. It took that to fill me up. Because I would put spinach and mushrooms and peppers in it, but I was still hungry. Like it was 2 plates of food, not 1.
Were you hungry, or did you just want to eat? Because like when I go home,
no, I was hungry.
I just want to eat while I'm doing emails and the TV's on. It's not even that I'm hungry. I just want to snack. So if I have a box of Wheat Thins, I will eat the whole box of Wheat Thins within 30 minutes. They'll be fucking gone. But if I take the Wheat Thins away, because I'm eating the Wheat Thins with like meat and cheese and shit.
Right.
If I take the Wheat Thins away, I'll eat the meat and cheese and I'll be done fucking eating.
With me, I just ate that much because I was hungry. But that was long. I mean, I was training hard. I lived a life around that back then with my work schedule. I couldn't eat that much food now unless I really, really tried.
I didn't eat a piece of chicken for 3 years after your diet.
You get burned out on it.
Is it true?
Mm-hmm.
3 years, I didn't eat any chicken.
When you eat the same exact thing repetitively, it gets old.
Right.
I try not to ever do that, but it gets old if you do.
I can go. No matter what I try, I can't seem to change my weight. I'm 5'10", always between 195 and 180 when I gain muscle. I lose the fat. Then I gain the fat, I lose. When I gain the fat, I lose the muscle. But no matter my weight seems to adjust so that I never break out of that area. Any suggestions?
Do you know how old he is?
We don't know any of it.
Okay. I don't know your age, but if you're over the age of 25, you definitely need blood work and a hormone panel. And the guy who asked about eating at night, same thing. You need a huge hormone panel and blood work done because appetite is from a hormone called ghrelin, which is antagonist to growth hormone. I don't want to get too detailed with that, but if you're having cravings at certain times and you're worried about digestion and storing fat, then you definitely need a hormone panel. I believe everybody above the age of 25 should get a full panel done on everything on their body every year, as much as your insurance will allow. I mean, we don't need to spend $10,000 on blood work. That'd be crazy. But you need to check your heart, your liver, your kidneys, your prostate. You need to check everything: cholesterol, triglycerides, testosterone, IGF-1, growth hormone, everything, every year. at least once. How do you know something's not going to creep up and grab you? I mean, you go 10 years between blood work, and you're like, dang man, my HbA1c is high, my blood glucose is high, I'm going to get type 2 diabetes. Well, if maybe you did that every year, you would have caught it before it got there and made changes. Because if somebody tells you, hey, you might die of a heart attack within the next year if you keep this up. Well, if you've got a wife and kids, or if you've got a will to live, you're probably going to make some changes. Nobody wants to leave your family for no reason if you could prevent it. So those questions tie into that. Without blood work, I don't know, because that makes no sense unless you're not doing the proper things with nutrition. There's no way you gain muscle and lose fat and then vice versa and stay within the same parameters if you're doing it the right way.
Well, it's kind of, I mean, he's probably where I am.
But he don't know what to do or don't have time what to do.
Like when
to do what needs to be done.
When I get on that when I do 45 minutes to an hour of cardio every day, my weight stays about the same, but I look different because the muscle weighs more. I burn the fat down. It's just like you take a dude that's 200 pounds and you cut him down, you know, you drop his body fat from 25% to 10, 12%. You know, he drops 20 pounds, but he looks bigger. You know, like,
yeah.
You know,
you will look bigger with lower body fat regardless of the weight, as long as you don't lose muscle. And that's, I thought that's what he was saying, was he didn't know what to do, right? Is that correct? He don't know what to do, right?
No matter what I try, I can't seem to change my weight. I am 5'10" and always between 195 and 180. When I gain muscle, I lose the fat. When I gain the fat, I lose the muscle. Well, it's probably because you start working out, so you lose fat and gain muscle. And
so he's going back and forth like
yeah, and it's the typical, it's the normal, you know, worried about what the scale says.
Yep.
Rather than what the mirror looks like in measurements.
And I don't know if he's trying to gain above that weight or lose beyond that weight. But I mean, if he's trying to get bigger, you just got to keep going. You got to gain muscle.
And you can potentially gain what, 7 pounds of muscle a year?
I think that's potentially right. Because most
and
people,
a pound of muscle looks like that.
5 to 10 pounds is usually the range I give. So 7's, you know, we talked and I told you that 5 to 10 is my range.
So without, you know, you're not gonna take a dude that's out of shape and pack 20 pounds of muscle on him without all kinds of chemicals. But if you just take your time and do it over the years, you know, and you know, you're gonna look way better next year, and on the second year you're gonna look even better. It just takes time.
And the muscle weight we're referring to is pure muscle tissue.
Right.
Like real muscle weight, not tons of water. Because if you got bodybuilders taking tons of anabolic substances and they're weighing heavier, so
right.
Okay, they're 30 pounds heavier, that's what they say. But if they were dieted down to 4% body fat and doing competitions, their dehydrated weight competition the year before to the dehydrated weight the competition this year, 5 to 10 pounds
right.
difference.
Same
and
thing.
They're on all kinds of stuff. It's the water.
Right. Court Sassaman, Justin, I believe that I have tennis elbow, a pain in my upper forearm that restricts strength and movement. And from what I read, it is a torn tendon. It has been over a month now and has not gotten much better. Is there much that I can do to aid the healing? Lastly, I had a friend tell me to buy some tennis elbow oil, essential oil, and rub it into the skin, say at my wrist, to help the pain and healing. Snake oil.
So tennis elbow and then a torn tendon?
He's
tennis
not sure
elbow.
which, yeah.
Okay.
I think he's saying that tennis elbow is a torn tendon.
I don't think that's accurate. If it was torn, it would come off the bone and roll up. You would see the muscle completely tear away if you're tearing the muscle there. But he may be talking about a tendon. I don't know. I've never heard of that. But called that. He may be calling it something different than that we talk about.
So what is tennis elbow?
Tennis elbow, or quote tendonitis, or golfer's elbow. That basically, tennis and golfers typically recur to the location of your pain. It's all the same tendonitis or tendinosis. One's more acute, one's more chronic. So I don't know about the creams and the oils. I've tried a bunch of things but never seen anything actually heal an injury that's not a prescription. You can try it. I'm sure it helps. It helps with inflammation or blood flow, which is great. But there's a company I'm working with that I've got making me prescription creams, and they are made at a compounding pharmacy to heal the body and increase blood flow for tendonitis and whatnot. But again, you have to see my doctor and you have to have a prescription, so it's not like something you can go get. On top of that, you got to do soft tissue work. I spend a lot of time doing soft tissue work every week on clients. There's, for him, trigger point therapy, ART therapy, Graston therapy, then just regular deep tissue massage therapy, and he could probably get away with some of body tempering. And on top of that, he can do Dr. Kelly Starrett's stuff that he likes to do, the mobility floss, or mobility voodoo floss. But what I do with my people that has tendon elbow, I do all of those things. I don't do just one, because I've had tendonitis, and it was crippling. Like, I could not hold the bar with so much weight, and it hurt. Well, I kept going and going and going, and then before I knew it, I couldn't hardly hold my bottle of water. And I had it in both arms, and that crap hurt so bad. I just wasn't recovering enough, I wasn't hydrated enough, I wasn't eating enough quality nutrients, so my body was steadily breaking down, steadily inflamed, which is what he's saying. And the pain didn't quit until I got into the soft tissue work. Now, you can Google these things, you can YouTube these things, you can research them, okay? You will get some good info, and I think a lot of this you can do yourself. Save yourself a lot of money. But don't get sold by somebody who says they're an expert in something, and they're not. In a lot of states, you can take a 6-month course and be a massage therapist, okay? I don't know if that's enough, maybe. But you can learn just as much with a few videos and a few techniques for one area than you probably get from a person unless they're licensed. So if he'll do a little bit of the stripping, the muscle stripping, the trigger point work, and a little ART, in the layman's world, you could do a pin and stretch. So find the area of pain. So pick your hand up, find your pain, press it, pull the skin, make it tight, and then stretch away from it. And then relax, do it again. Pain, pull, make it really tight, stretch away from it. Do some of that, and then I do just the stripping where you just push and drive up into the muscles. Strip them apart, get the blood flow, move it around, then take a heavy object. You need your arm flat on a table or whatever, like this. You take that heavy object, which I use a 3-inch round steel, block of steel I had made. It's 45 pounds, and I just roll it really slow. I don't put it on my wrist. I put it on the muscles. And I use that everywhere. It's called body tempering. Donnie Thompson made that famous back in 2014. It's really good stuff. We've been using it ever since.
We used it up here last week.
I used it on John last week.
It doesn't look like it weighs 100 pounds, but when you carry it up the stairs, you're like, if I
you
drop this, it's going to break these stairs.
And Graston technique, you have to go to a course to get the equipment I have for that. It's really expensive stuff, but it's really good. There's a few knockoffs. Don't know how good some of those are, but if you get the mid-range, you may be okay. And that's just getting the skin, the muscle in the skin. You could do that yourself with a butter knife, probably. Backwards, not the sharp end.
So
but
you can find most of that on YouTube.
Everything that I just named, you need to write them down.
All right, real quick,
YouTube.
what should he YouTube? What was he looking for?
ART therapy, trigger point therapy, deep tissue massage and stripping the muscle, Graston technique, body tempering, voodoo floss, mobility wad by Kelly Starrett. He's got stuff just for that. I don't remember if I left any out. Hell, I got so many.
Okay.
But I can keep going, but I think I'm going to overwhelm you.
That's going to start. Michael Bloxham, best thing to do for weight loss workout-wise. Don't have much time due to work hours.
Okay.
Best thing for weight loss.
Okay, so when I have people that don't have a lot of time, I'm thinking 30 minutes. So if I'm thinking 30 minutes, if you got an injury or an issue, well, that's a problem because you need to spend time working on that. But if we're not talking about warming up or injuries, you need to pick a core lift every time, no matter what it is. You need to lift it hard and lift it heavy as long as you have good form and you're not creating injury. Okay? Then you need to pick something that you can do for high intensity. And that's what I would do if you don't have a lot of time.
So for weight loss, you still want them to do a a core workout.
You have got to stimulate something.
Okay.
And what I'm referring to is, I mean, there's some very simple people out there that have got famous by writing down the same thing that somebody else wrote down. And it'd be like bench, squat, deadlift, shoulder press. Okay. Well, there's nothing to it. They're just rewriting the same thing. Well, there's 4 lifts. Do one of those every day, and then as soon as you're done with that, do something that's high intensity. Metcon, metabolic conditioning, CrossFit made the crap famous. Tabata made it famous.
So you want them to do like 3 sets, 4 sets, 5 sets of, say, bench press on Monday?
Okay. I like 5 sets because it takes a while to warm up. I'd really like 10, but I don't think people can understand or handle that. And when I say 10 sets, if it's bench press, I'm going to do 3 with just the bar. Wow, that's a waste of time. Maybe for you, but it ain't for me. I do 10 reps, wait 20 seconds to do 10. It's programming the movement. You have to have the proper movement pattern.
So one major lift and then straight into cardio?
Yeah, but if he's got 20 minutes or whatever.
Okay.
You don't have time for anything else.
JD Smith, best metabolic booster for 40-year-plus year-old male trying to get back in shape.
Well, the best that we've seen with blood work and results is the hyperlean or the SF, but they're different strengths. So the SF we just reformulated a few months ago and got it. We added something to increase metabolism and help you excrete some of the excess subcutaneous fluid. It's really nice because you can use 150 milligrams of caffeine, which is a very low dose, and you can feel it. Okay?
I do feel it more.
And you don't get tingly or like I hate the tingle.
I like the tingle, but
the carnosine tingle is itchy. We don't put any of that in our stuff. But
I take it separate.
You take that?
No,
you don't take that.
Yeah, so I know that it's. So
I
know
knew
it's
you were
working.
BSing. I was like, wait a second.
So I know it's working. No, but I do notice the new 187. I do feel it more.
It's totally different. That one ingredient. Yeah. I did that because I want to keep the caffeine low because some people are stimulant sensitive, and then I don't want to smoke everybody with a ton of stimulants all the time.
But they can still double it if they want.
Yeah, yeah, easy. And then the hyperlean, again, I made that years ago for the reason of breaking it in half or taking less. Taking a whole one is 300 milligrams.
I took a third of one the other morning.
Got you going.
It was too much.
Mm-hmm.
It was too much.
The reason I did that was to give people more for their money. I was like, I put 60 capsules in there. The place I bought them from said, what about 30? Because this is a lot. This is going to last a long time. They're not going to come back and buy more for 2 or 3 months. I'm like, that's okay. Unless you take a ton of them, which is almost impossible.
Mm-hmm. I think we should do a case study.
You talking about Tyler that worked here?
Yeah, Tyler.
Yeah, how many of those did he take?
If I could pop 2, right?
Like when we're joking about it, like we're joking, but we're serious. Like it was.
He really did that?
Yeah.
He would hide it.
It was like.
I thought that was a joke.
No,
that was true.
It's true. He would hide it.
He would hide it because we would confiscate the bottle.
Really?
Yeah.
Yes.
Okay.
And then if you had a hyperlean, like if I had one.
Yeah, man. I know you got. I know you got that hyperlean.
Anything.
I didn't know that.
Yeah.
I thought that was all jokes.
I need one.
No.
I need one, buddy.
Yeah, buddy.
You gotta get in there.
Yeah, he's
I always
calling
break
people
them.
up on the weekends.
I never take the whole thing. I took half of one for a
Like
really
he
long
paid $5 for one pill.
Yeah.
No,
Yeah.
it's not bullshit.
Well, it's
at all.
because in hyperlean there's ingredients in there. They give you like a good euphoria, and it makes you feel good. I mean, if you have any kind of chemical imbalance at all, or you're tired, or you're lethargic, you take it and you feel better. You literally feel happy. It's from that chocolate. You know, dark chocolate has extracts, which I don't want to go into all the chemical theobromides and cocamines, but it's in there, and it makes you feel good. Everybody likes it.
All right,
if you
Chris.
take too much, you'd be shaking.
Chris Elliott, how is the shoulder healing since the stem cells?
Man, that stuff has been awesome. It has been awesome. First 6 weeks, when I originally had it done in October, of course I videoed it and put it on YouTube because I wanted everybody to see it. Nobody videoed the whole deal with stem cells. Nothing out there. It was BS. So I was like, you know what? If I'm spending all this money, which it was a ton of money, I was like, I'm videoing this and I'm going to show everybody so they can see. And I had it shortened into like 8 minutes or whatever. But they go in, they drill it out of your hip.
Does that hurt?
They give you the numbing stuff to numb because it's just which you could see it on there, but they take it in there and they draw it out with a 60 milliliter plunger, and then they
So is it coming out like bone marrow? Or?
bone marrow out of the hip, iliac crest, the upper part of the hip, the thickest, best part.
Because you always hear like when they test you for transplants and shit, like it's very. You always hear how painful it is, and you hear all kinds of shit. So you didn't feel it.
Well, I mean, it ain't what I would consider pain. I mean, they numbed it, but I have a different pain than most people, and I did. So, would it be painful to the average Joe? Maybe a little, but
Like
without numbing stuff, it's gonna hurt.
When I get the implants, like the time before,
Lidocaine.
yeah. So 3 injections, that really burns.
Yeah.
But then when they stab that and make the hole, you're numb. They're like, "Do you feel that?" I go, "No, I don't feel it, but I know you just put a scalpel in my ass."
Right.
But we were driving home,
Because you can feel the pressure.
and somebody, I don't remember who I was with, I was in the car, and they go, "Does it hurt?" And I go, "Yeah, it's going to be fucking sore later." Well, when I got back and I had taken my pants down, I realized they didn't even do that side. They had done the other side. And I didn't, like, he numbed it up so fucking good, like, I didn't feel it until midnight that night.
My body metabolizes that stuff really rapidly, and I metabolize everything, drugs really rapidly. So when I do the lidocaine, I have to have a very large dose, and I have to have multiple dosages, because I feel everything. So I did feel some, but I know to feel some because I had the testosterone pellets before, and I had the full serving of lidocaine. 20 minutes later, I was completely normal. I had another serving of lidocaine. And they're like, okay, well, we're going to get into the limits of what we don't feel comfortable giving you anymore. And I was like, okay, well, just a little more because I still feel you cutting me. Because they're like, do you feel it? And I'm like, yeah, you're poking me. They're like, it was my first time ever. Ended up, I just took it and it hurt. I mean, my eyes watered. I didn't cry, but I could feel the water coming out. Like if you get popped in the nose, that feeling is what my eyes were doing. First time I ever got pellets.
Man, 20 minutes, like, fucking by the time they're fucking putting those 3 injections in to putting a bandage on, I'm not even in the room 15 minutes.
They couldn't give me nothing. I mean, it took a really long time, and now I have to just do a different protocol than other people. I have to just be ready. Hey, this is going to hurt. It don't work on you. And with the stem cells, it was not that bad, so I don't think it hurt. And then when they do the shoulder,
So they take
it
them
hurts
out.
a little.
How long from taking them out are they putting them in?
Most places have to send your bone marrow off. The place I went to was a stem cell research facility, and they actually had an entire sterile room. They did the procedure, and then a sterile room attached to that room where all the stem cell equipment was, or the PRP, platelet-rich plasma equipment. So he cleaned, washed, prepared my stem cells there. It took about 5 hours between taking them out, and I had to lay there. I just lay there on the
For
bed.
5 hours?
Yeah, I did. Me and the doctor and the nurse just talked about, biochemistry and cellular metabolisms and all that cool stuff. So they thought I'd fall asleep, but I didn't, because again, I metabolized the drugs so fast. They gave me like two of the 10 milligram pain pills before, and 2 of it's like a Valium or something. And I took those, and they're like, "You're not tired or falling?" I'm like, "No, I don't even think that stuff worked." And they gave me 2 more. So within 2 hours, I'd had 4 Valiums and 4 pain pills. And I guess I don't even remember taking it. I remember everything that happened.
So once they have them ready, how long does it take to install them?
When the 5 hours was up, it might have took 5 minutes per joint. I did some